we go. Welcome to those of you who are just joining us. We're going to just give a minute for people to get logged on, and then we'll go ahead and get started. Thanks to those of you who are just joining us. I think we'll give it another minute or two and see whether or not there are other people who are going to join, and then we'll go ahead and get started. So just hang tight for a second or a minute. That's it. All right, I think we will go ahead and get started. I'd like to start with land and labor acknowledgement. The version that I'm using was written by one of our staff in Public Health Global Health, Tess Matsukawa. And so I want to thank her for her lovely language and her willingness to share it with all of us. We want to start today's session centering ourselves in a land and labor acknowledgement. It's vitally important for us to know the long-standing history of where we are and what has shaped the context of the land we inhabit. The University of Washington acknowledges the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Suquamish, Tulalip, and Muckleshoot nations. Land that was stolen by European colonizers. Land that was stolen from the Duwamish, who are still here and continuing to honor and bring light to their ancestral heritage. This country was built on stolen land with the exploited labor of enslaved African people, as well as the exploited labor of underpaid Asian and Latinx peoples. These acts of colonialism, white supremacy, and anti-Blackness are the history of this country, as well as our ongoing and current reality. We want to honor and recognize the lives, knowledge, and labor of Black and Native peoples in the past, present, and future. There is an immense need for action within the School of Public Health and in all other systems. That action needs to be centered on liberation for Black and Indigenous peoples. This requires understanding the context of where we are, our own positionality within those systems, and a dedication to justice-based action. So again, thanks to Tess for those beautiful words. So for those of you who are just joining us, today's webinar is for faculty within the UW School of Public Health. As always with these webinars, the guidance that I'm providing is for individuals who are primary in the School of Public Health. So if there's something that I say and you think, I wonder if that applies to me when I'm primary in some other school, then you should definitely check with your supervisor or the department chair or dean in the school that you're primary in. So what my plan is for today, is to start with a summary of where we are. There's been a lot of messaging that's gone out. And so I want to make sure that everyone's on the same page about that. And we will provide links where possible to some of the things that I reference. As we're going along. So I have a couple different people here to help me out with that. Jashana and Elazar, as always, providing excellent support and making sure that I'm staying on top of things. And then in case we have questions from folks where I need to call on for assistance, Uli Haller's here, our Assistant Dean for Finance and Administration, Carrie Farquhar, our Vice Dean for Education, and Juanita Ricks, our Assistant Dean for Students. And for those of you who haven't met her yet, I see that also in the background is Shiva Shafi, who is our fantastic new Director of Marketing and Communications. Okay, so first of all, and then once I go through sort of the updates on where we are, I will also turn to some of the questions that we got in the Google Doc ahead of time. For those, whoops, change this to everyone. Okay, putting in the chat box the link to the Google Doc. As a reminder, if you want to put something in the Google Doc anonymously, if you are already logged on to Google in your browser, you will need to log out of Google and then click on the link again, and then it will assign you anonymous, some animal. There's like anonymous aardvark or something like that. Okay, so starting with a summary of where we are. As I mentioned, there have been a lot of communications that have gone out recently. Hopefully all of you saw the most recent communication that went out from our president, Anna-Marie Kause, and our provost, Mark Richards, yesterday. So I just put the link to that in the chat box as well. A word of organizational stuff. So people are welcome to put things in chat. If you have questions, please use the Q&A function. And Jashana is going to help me in terms of sifting through those and making sure that they're collated. So we will get to those questions if you have questions. Okay, so I want to make sure that people have the link to Mark and Anna-Marie's message from yesterday. In addition, I'm going to put into the chat box a link to a message to instructors that went out from me and from Carrie on the 12th of August. Which in COVID time is a long time ago, that was providing sort of a framework for how things are going to be handled during the fall quarter. And then there was also a companion FAQs to that document, which I'm also putting in the chat box as well. Okay, so where we are. So just in the last couple of weeks, we've had a couple of big changes come through at the state level, which have informed policies at the University of Washington. And that was one of the primary drivers for the message from Anna-Marie and Mark Richards. One of those big drivers is that the governor has promulgated a vaccine mandate it was originally for state employees and did not include us. And then it was amended to include people who are employed in higher education in the state of Washington, as well as people who are employed in K-12 education in the state of Washington, and also people who are in pre-primary care facilities. And the original mandate also included healthcare workers as well. So as of right now, we are all included in that mandate. That mandate eliminated the philosophical exemption for the vaccine mandate. So we had already in place at the University of Washington, a vaccine mandate for faculty, staff, and students. And with the governor's order, that was the philosophical exemption that had been in place was removed. So now we just have a religious exemption and a medical exemption. And in addition, there's stricter guidance now from the governor's office about verification of vaccine status. So the update on that is we are still for employees. So that would be faculty, staff, and student employees, that we are still using the Workday system. For all of you who have already attested, thank you for doing your attestation. And the information that you put into the system is still valid and useful, with the exception of if you put in that you wanted a philosophical exemption or you were taking a philosophical exemption. In that case, you will need to go in and either indicate that you are vaccinated or change to either a religious or medical exemption. For those people who were vaccinated in the state of Washington, which is the majority of our employees who are fully vaccinated, we do not anticipate that you will need to provide additional data because we are able to access the verification for all of you through the Washington DOH vaccine registry. So there will be additional verification. So if you were vaccinated outside this state, then you will most likely get contacted with a request to provide additional verification. But if you are vaccinated inside the state, you probably will not get contacted because we probably will institutionally be able to access that data, those data for you. For people who put down that they wanted to take either a medical or religious exemption, you will be contacted to provide additional information. My understanding is that individuals claiming a medical exemption will need to provide documentation from their healthcare provider, and those claiming a religious exemption will have to provide detailed information about their religious affiliation or religious beliefs. By the same token, students are also subject to the same vaccine requirements. So the timeline has moved up considerably in terms of requirements for all of us based upon the governor's mandate. Everyone who is employed by the university, according to the governor's mandate, needs to be fully vaccinated or have the evidence of their eligibility for medical or religious exemption in the system by October 18th, or they will no longer be eligible for employment at the university. And the university has inquired as to what no longer eligible means. And the governor's office has communicated to us that that means that by that they meant terminated as opposed to furloughed. So obviously there are issues in terms of how to handle that with tenured faculty, but the bottom line is that absolutely, if you are vaccinated and you have not attested already, please do go into the system and attest as soon as possible so that we don't have any kind of employment issues or difficulties. If you are not vaccinated, we strongly encourage you to get vaccinated as soon as possible. And there are resources from the university about which are linked in Anna-Maria and Mark's message for where you can get access to vaccine here at the university. And if you're claiming an exemption, getting that documentation in place as soon as possible is also really, really important. So that's one big change that we had put into place in the last couple of weeks. The other big change was that on top of our own masking mandate at the university, that the governor put into place a mask mandate for the state that is for indoors for all individuals, regardless of their vaccine status. So you'll see in the message from Anna-Maria and Mark a lot of details about what the implications of that are and how that's being rolled out, similarly with the vaccine mandate. One of the pieces of information that didn't get included in that, but is now available through the EH&S website, is information about guidance for safety, COVID-related safe practices for eating and drinking indoors. That guidance is not meant to be super prescriptive, but rather to give people an idea of what is considered to be good practice and what is not. But what you will see when you review that, and hopefully someone can find the link for that for me and insert it. And if not, I will do that when I get a chance. When you review that, you will see that, for instance, there will be some culture changes that are needed. So for those of us like myself who like to sit here at my desk with my water or tea, the expectation would be that when you're at work, that you would be wearing a mask at any point, unless you're by yourself in a closed office. And that if you needed to drink, for instance, sitting at a desk that was in a shared space, or students in a classroom, that you would take your mask off just to take a sip and immediately remask. That we wouldn't have people sitting and drinking slowly over time with their masks off. Likewise, there's recommendations that people would be eating in designated eating areas where there's good physical separation, and where there's good ventilation or superior ventilation. We have good ventilation throughout. So those are a couple of big changes. Some things that have not changed but are kept in place are that we are planning to be in person, having in-person instruction, predominantly in-person instruction for the fall quarter. For that reason, we have the campus is having a return to work in person for staff on September 13th to give us a chance to get staff reintegrated into their work schedule of coming to campus before students start to arrive on campus. Our first students are actually already here. Our medical and dental students have started already. And we have people arriving in the Greek system this weekend. And then next week, additional students starting to arrive, and orientation the week after that. So the idea is with the 13th is really to give us a chance to get everyone sort of transition back and normalized to being back on campus prior to the arrival of students. So with that transition, we didn't send it to, I guess we did send it to all of you, but we sent out to staff a reminder to them that that they need to have telework agreements in place if they are not going to be 100% in person effective September 13th. So they need to have those agreements in place before the 13th. What we're seeing is that the majority of our staff in the School of Public Health are working either a 2+3 or a 3+2 schedule, meaning they're either 2 days in person and 3 days remote, or 3 days in person and 2 days remote. And so we're expecting that we're going to have probably somewhere at or below 50% occupancy in most of our on-campus sites as of the beginning of fall quarter. So through that hybrid work schedule, that we will see significantly lower density than we would have if everyone were to come back full time. That being said, people are welcome to come back full time if they want to. We sent the information about the telework agreement requirement to faculty so that you would know about it, because many of you do supervise staff and supervisors need to sign off on those agreements. But you as faculty do not have to have telework agreements in place. So as has been the case pre-COVID and throughout this time, faculty are able to determine their schedule and determine whether they're working on site or working remotely on a day-to-day basis. There is not a requirement that you come to campus if you are, so you need to come to campus if you're teaching, in particular teaching in person. For instruction, you do not need to come to campus on days that you are not teaching or if you are not teaching at all. I guess I would just ask that you communicate clearly with the people that you supervise and that the teams that you work with about what your plans are so that they know how to get in touch with you. And certainly if you're in some sort of leadership position like a program director where you're providing supervision for staff or serving as backup for staff who are working with students who are dealing with crisis management or student concerns, where they may need you to be there to assist them, but certainly that you consider being present on campus to be able to fulfill those roles. It doesn't mean that you have to be here full time. We do want to remind everyone, though, that it is important that we would like people to come to campus occasionally, at least, because if you're not available or to make sure that the students that you mentor, in addition to the ones that you teach, are aware of what your schedules are and how to get a hold of you, because there are many functions that faculty play in terms of interacting with students that don't have to do with the direct classroom environment. And so we don't want the responsibility for all of those activities to fall on the shoulders of those faculty who happen to be here for in-person instruction. Okay, let me do a mental check of instructors. Okay, so several people asked about why are we teaching in person in the fall? That is a campus-wide decision to do it predominantly in-person instruction. Individual units are not able by university policy to make a decision to have their program or their courses be remote instead of in person. So instead, we are monitoring this situation carefully and working closely. I work very closely, as do others. Janet Baseman also serves on the advisory committee on communicable diseases for the campus to make sure that the campus is well informed about what the status of the pandemic is and making decisions that are aligned with the current local and state public health guidance. In addition to the CDC, but usually our local and state public health guidance is more restrictive than the CDC, so that's usually what our campus aligns with. So that is why we are predominantly in person. If you yourself have reasons why it is not safe for you to be in the classroom, you should definitely contact DSO, the Disability Services Office, and work with them in terms of accommodations. If you need an accommodation because or you need a special, accommodations are supposed to only be things that are officially through DSO or DRS. But if you need a special arrangement, for instance, you're living with someone who's immunocompromised, you're concerned about their health and well-being if you are out circulating with other people, then you can submit a request to your department chair, who will in turn forward the request to me for permission for a special arrangement, for instance, to teach remotely. So deans have delegated authority from the provost in a limited number of extenuating circumstances to allow people to teach remotely, but we are not allowed to, as I said, to just sort of make a blanket category and say people in this category will be teaching remotely. So please don't hesitate to reach out if you feel that you qualify for one of those special arrangements or you have specific concerns. And the details about how to do that are provided in that link that I gave you about in the message to the instructors, and also the FAQs for instructors goes through some of those specific cases. I also want to make sure that all of you who are teaching are aware that Carrie and Uli have been working in tandem with folks at the Health Sciences Services, which is what we used to call it Health Sciences Administration, to make sure that that we have the equipment that you need to record your classes in case you have students who either are not able to get here and to take classes in person for visa reasons or because they themselves are immunocompromised, or in case you have students who are out short term because they're either sick or quarantining. So if you haven't seen emails from Carrie about that, please check your emails and get back to her. They're working there to work with you to make sure that you have the resources you need. We've hired instructional TAs to help with that transition, and there's a bunch of trainings that will be available. So again, a lot of that information is in the message for instructors, but we can also have Carrie talk about that a little bit later as well. So for you yourselves, I fully recognize, and the campus fully recognizes, that there will likely be, over the course of the quarter, instructors who either themselves need to quarantine because they've been exposed to COVID, or who have children at home, for instance, who are in the Seattle Public Schools, who were exposed to COVID and need to quarantine. And so as a result of that, we are asking that each of the instructors come up with a plan ahead of time for how you would shift to remote instruction, and make sure that you clearly articulate that plan and how you would notify students about a short-term shift during the quarter if necessary to remote instruction in your syllabus. So again, check out that FAQs for instructors. There's some samples of syllabus language that you can use there. Carrie, what have I missed in terms of message to instructors that we want to hit in terms of highlights? Anything?
I think you've hit pretty much everything. I
noticed that we have some questions.
One question in the chat, right?
Yep.
The question about wearing masks when lecturing, if you wanted to.
Yeah, so the wearing masks for lecturing, this is a little bit of still of an open-ended question. So before the governor's mask mandate went into place, the university had put into place the universal mask mandate, and we had allowed explicitly that instructors could take their masks off when lecturing if it was a large lecture room, not in a small room setting, and if they were well distanced from students, so really in sort of that auditorium style format. The governor's mandate does not allow for that exception. And so we have removed, currently the university has removed that from the masking guidance that we have on campus. However, we still have a request in institutionally to the governor's office to allow us to have that exception reinstated. So I would say keep your eyes peeled on that, but as of right now, the answer to that is no. Carrie, do you want to talk a little bit about thoughts about microphones?
Sure. Yeah, I'll talk a bit about microphones. So, the expectation is that presentations will be recorded with the full understanding that that's not going to be possible in all situations, particularly when it's a more student-centered active learning classroom. But whenever possible, our expectation is that presentations would be recorded. And what we're doing then is working with individual faculty, and a survey has gone out to all teaching faculty in autumn quarter to find out whether you have your own microphone or you need a microphone. And we'll be sending out a communication next week, because now we have responses from about 100 of the 116, 17 faculty who are teaching. So we know what room you're in, whether you have a microphone or not, and we'll be communicating to you whether there's a microphone. Many rooms actually have the lavalier microphones already there. If not, we'll coordinate with your department to ensure that you have a microphone that works with your laptop type. And that would be for you to keep during the entire quarter, if not longer, particularly if you're teaching later in the year. So that's how what we're thinking in terms of microphones. They'll be worn outside the mask, not inside the mask, but they would be able to capture what you're sharing with the rest of the class.
Thanks, Carrie. Okay, I see a couple of questions. Carrie, I'll come back to your question. Different Carrie, Carrie and Kaylin. I'll come back to your question about parking, but I wanted to talk about a couple of other things related to vaccine and masking mandates. So Steve Schwartz asked whether or not this UW state vaccine mandates applies to faculty who are not employed by the UW or state. My understanding, Steve, is that the answer to that is yes, that anyone who is paid by the university, even if it's as a contractor, is bound by the governor's mandate. So the university is still working on how they would handle that. But if you have paid faculty, even if they are part-time faculty, they will be bound by that. And apparently, it also applies to faculty who are not in residence in the state of Washington. So let's say you had someone who was teaching remotely. If they're being paid to teach by the University of Washington, they are still subject to the state governor's state mandate. John Hartgraves asked, does a shield work as a mask while lecturing? The answer to that is no. So face shields do not provide significant protection against transmission of COVID. So they do not substitute for a mask, and in general are not recommended as an effective strategy for preventing transmission. But you are reminding me, John, of something that is very helpful, which is, and I'm putting in the chat box right now, which is that Public Health Seattle and King County, their blog site, which is called Public Health Insider, had a blog post earlier this month specifically on masks and the recommendations for masks with Delta variant. And I highly recommend that folks check that out because it is very helpful. And it goes into very specific details of what kind of mask they recommend for different types of situations. Uli did purchase, so if you have a student in your class who is hearing impaired and you need a mask that has a plastic component so that students can see through it to see your mouth, we do have those available for instructors, and Uli is the right person to see about that. Okay, so a couple of questions, Carrie, about recording lectures. I'm going to let you go with that.
Let me go ahead and address that one. So the question is whether one needs to record the class if there are pre-recordings already of that same material. What I would say is I would encourage you to go ahead and record it anyway on Zoom, and we will have instructional TAs as well as trainings on how to do that. And then whether or not you opt for students to listen to a pre-recorded one or that one that you just recorded could be at your discretion.
The question that I'm seeing is actually one where they're doing a flipped classroom. And so
if it's a flipped classroom, then
yeah, so it's like discussion in teamwork in the classroom that I don't think they need to record, right?
I just know many of us, including myself, and I'll be teaching next week, my class starts. I have pre-recorded talks, and then the same talk I'll be giving synchronously live. And it's actually going to be better for students to listen to the pre-recorded ones if they can't physically make it to the class or synchronously listen. So I think there are a lot of different ways to make it work. The key is that we do want students who can't be in class because they're having to quarantine or they're ill or they have one of these other special arrangements or a disability arrangement, that they will have access to as much material as they can. And in terms of software, right now we're working with either Panopto or Zoom. Many of the rooms where you'll be teaching will have Panopto there already. And then in that case, Panopto is fine to use to record. And some of you are quite comfortable and have been doing that for some time. If not, I think Zoom is going to be the easiest mechanism for us to record and Again, the instructional TAs will be available. We'll be having trainings on how best to do that with the mics and upload them onto Canvas sites.
Steve, I noticed that you clarified your question. Sorry, I misunderstood it. So you were asking about people who are just coming and giving one guest lecture who are not being paid. I don't think that the vaccine mandate applies to those individuals, particularly if they were giving it remotely. But I will check on that and get back to you on that. I'm not absolutely clear on what the requirements are for guests on campus. And I should add as well, expect to see some changes in this in the coming week. We're expecting announcements from both King County and from the governor's office about vaccine requirements for events, including outdoor events over 500 people, and for that to be coming out in the next week or two. So I think there's just going to be a lot more clarification and probably a lot more restrictions sort of coming down the line. Carrie Farquhar, Carrie Kalin asks, when will the instructional TAs be available?
Yes, so the instructional TAs start autumn quarter, so they start September 16th. I have been already meeting with them, working with them to set up their schedules. They will not be available in the classroom with you per se. That wasn't the plan. If there's a special need for that, we can see if it can be accommodated. But the idea is that they will set up a calendar for like one-on-one or open office hours where they'll be able to provide individual or to group support. And that calendar will be up and running as of the 16th. So in a good 2 weeks before the first day of class, in addition to having these open trainings that we've been working on setting up. And is there support for evening programs? What I would do is reach out to me, Carrie, and we'll see how we can make ourselves available. I think for the TAs, often evening hours work really well for them too, because they are in our programs and they're taking classes during the day. So some of their office hours may actually be in the evenings.
Yeah, so Jim, your question about how would it be possible for guest lecturers to participate remotely? It really depends upon what the setup is in the classroom that you're in. And so that is a great example of, so you should have received notification from Carrie about what classroom you're in and what the setup is in that classroom. And then I would say reaching out to the TAs and saying, how could I do this, or can I do this in the classroom that I have? And if so, how would I do that? And maybe figuring out a time to meet them ahead of time at the classroom before the quarter starts, to see how you would do that would be a great idea. We didn't get back to Carrie Kalin's original question about parking. So I do want to acknowledge that for many of us who moved into HRC a year ago, that we moved in and didn't really have a chance to get sort of situated in there. And so I know that in my case, I've been going in a couple days a week just to sort of get my bearings and figure out how I'm going to do things. I did switch my parking spot, and because I'm in HRC and I used to be in the F wing, and I am now parking at Portage Bay Garage, which is, I have to say, fantastic. It's a great location. And also they have this pay-per-use parking permit for that, which is really awesome. And it's not that far of a walk from Odegaard if you're teaching at Odegaard. But you should talk to your department administrator about parking. But I do agree there are probably many people who will want to sort of reassess their parking situation if they have moved their office or things have changed since the last time that they were teaching on campus or being in the office on campus. Okay, we've gone through a bunch of these questions. There's some things that I didn't touch on that I did want to come back to, because we've heard a number of people expressing concerns about how will we know whether or not people are vaccinated. or who's vaccinated? And the answer is you will not know. So that is personal, private health medical information. So we are not, although supervisors can see the people that they supervise, whether or not they've attested and what they have attested. We are not allowed to share that information other than aggregated information for large groups of people. So Uli pulled together for us aggregated information for a large group of people, i.e. all the employees within the school. And here's where we were as of yesterday. So 73% of the employees, so that's staff, faculty, and student employees within the school public health had attested already. So woohoo, thank you for doing that. And if you haven't, please do. And of those who had attested, 98.5% of those individuals indicated that they were vaccinated. We are expecting similarly to have a very high vaccination rate amongst our students. We had many students actually last spring who were volunteering in vaccine clinics within the region. And so many of our students were amongst the first to get vaccinated. Everything that we saw from early surveys were that the campus in general, the very high percentage of students indicated that they intended to get vaccinated. It's still running above 90% for the whole campus of the people who have already attested. I expect that for the school public health, likewise, it's going to be a very high percentage of students. But the reason that we have a mask mandate in place for the campus and for the state is because the Delta variant, we have found in the last couple of months that individuals who are fully vaccinated still can get the Delta variant and can transmit it, even though they are very unlikely to have severe symptoms or to require hospitalization or, fortunately, to die from that variant. So that is the reason that we have this very strict masking requirement. Your protection in the workplace is you making sure that, and you for yourself and for others, is that you should be really conscientiously masking and really paying attention to the quality of the mask that you are using. So definitely check out that Public Health Seattle King County site. Uli does have enough masks on order of cloth face coverings for everyone in the school to receive 2 of them. So if you have not received one and you would like one, you can get those as you return into the office. We also will have supplies at the reception desks as you enter areas. For instance, in the HRC, as you come into school public health areas with masks for individuals who forgot their mask at home or are visitors who didn't have a mask, didn't realize they needed a mask. And we have lots of signage up already, and we'll continue to post more signage, encouraging everyone and reminding them that it is mandatory for them to be masked. So definitely high focus on masking. I've heard from some faculty concerns about what do they do if they have a student who refuses to get masked? And we will provide additional written guidance for all of you on that. It goes for everyone in our environment, whether it's in the classroom or it's walking around the offices, that if you see someone who is not masked or not properly masked, that the first step, of course, is to just politely and kindly remind them that we have a masking requirement and ask them to put their mask back on. I think it's going to take all of us a little while to get, used to sort of that new sense. I'm even me, and I'm a pretty religious masker. There are times when I walk out of my office and I think, oh darn, I forgot my mask, and I scramble back in there. So, it's just a normal part of sort of adapting to the environment. Our goal is to have the kind of rigorous masking in our school that you see in clinical environments. So the policies that you will see and the recommendations that you will see are very much aligned with those for the clinical environments at UW-Medicine, where they have proven to be very effective at limiting workplace-based transmission. So So that is what we are aiming for. We do not, our goal is for you not to be getting exposed to COVID in the workplace and not to be bringing it home with you. But again, if you have someone who's particularly vulnerable at home, or you are particularly vulnerable, be sure to communicate that with us so we can figure something out. Okay.
There are a couple questions there, Hillary,
Yeah.
about exposure in the classroom, which I think
Yeah.
would be good
Yeah,
to
so
address.
yeah, really good questions. And there are good links to this in the messaging from Mark and Anna Mari about the protocols on campus. We have a very rigorous contact tracing program that was set up by Janet Baseman and the SEAL team, but it's working independently at this point by EH&S. They follow the same protocols and are collaborating with Public Health Seattle and King County and DOH. If you had a student in your class who tested positive, you and the other students who were potentially exposed to that person would be notified. You wouldn't be told who the student was, but you would be notified that you had a potential exposure. For individuals who are fully vaccinated, the CDC recommendation right now is that if you're asymptomatic, that you do not need to quarantine. However, if you are symptomatic, you do need to quarantine, and you're strongly encouraged to get tested. So we also have a very rigorous testing program available on campus. The campus is encouraging everyone as they return to campus, and all students as they come to campus, to get tested for COVID. And there are free testing sites available on campus. And in addition, the Husky coronavirus testing program, which is run by the Seattle Flu Study, will courier kits for testing to you. So for instance, if you are feeling sick, we don't want you to come to campus to get tested. You could go onto the testing program site, and they will courier a test kit to you, and then we'll come and pick it up, and then you go online to check what the results are. The typical turnaround time, it really depends upon, so there is obviously the time it takes for the person to get back their positive test, and then they need to notify. So if you get a positive test result, it will get reported to Public Health Seattle and King County. We ask everyone in the UW community to proactively tell UW EH&S so they can launch contact tracing, because otherwise there's a delay from Public Health Seattle and King County referring it to EH&S and then launching contact tracing. But they do have a fast turnaround at that point. Obviously, the limitations there are the amount of time it takes them to get in contact with most people. So if you get phone calls or texts or emails from EH&S, please read them immediately and pick up the phone and respond immediately. And certainly if you have a positive COVID test or a known exposure outside of campus, please make sure that you report that to EH&S immediately.
Yeah, I think there's a related question from Ellen about backup instructors and what happens if the instructor becomes ill and is unable to teach.
Yeah, so this is something that we deal with all the time. They're in a normal, normal non-COVID quarter. Obviously, there's sometimes when faculty become sick or are unable to teach. So if it's that you're quarantining and you're still well enough and you want to teach remotely, the easiest solution is to switch to remote instruction. If you are not able to do remote instruction, you would do the same thing that you would do under normal circumstances, which is that you would contact a colleague that it has the same subject matter expertise and ask them whether they would be willing to substitute for you. And certainly contact your department chair to let them know if you need assistance, if it's something long-term.
I just wanted to shout out to David Grombowski saying, should instructors on the first day review all COVID behaviors
Oh, please.
in the class? And absolutely, please do.
Yeah.
That would be Yeah, definitely highly recommended. Even send out emails ahead of time. Students definitely need to know they should not be coming to class if they're ill. They are all going to be wearing masks. That
You
has to
should not
be
be coming to
reinforced.
school if you're not feeling well.
And in the frequently asked questions for instructors, as Hillary said, there is a sample syllabus paragraph that can be put on your Canvas site or put onto the syllabus. It still needs a little tweaking, so I will, in the next couple of weeks, send out a revised version of it. I'm now putting it onto my syllabus, and I'm realizing there's some typos and some things that need to be fixed.
Yeah. Thank you, Jashana, for pointing me to the Q&A. So someone in the Q&A asked the question, sort of said that it sounded like from what I said that we're returning to teaching in person because the university said so. And let me just clarify why the university is returning to teaching in person. The reason that we are returning to teaching in person is the same reason that the Seattle public school system is returning to teaching in person, and that the American Academy of Pediatrics recommended that K through 12 kids, some of whom can't be vaccinated, still go back to education in person, which is that we're seeing very significant impacts on not just K through 12 kids, but also young adults, of the isolation and the difficulties with remote learning. And that is true for college students as well. And we are seeing differential impacts on low-income students, many of whom are in our community. So we have many students that fall in that category at the University of Washington, who are students who already are vulnerable in terms of not access to learning. And so it is with those kind of equity considerations in mind that we are returning to the classroom in person. So I saw people asking, like, Amazon's not going back, where are we going back? We are going back for our students. It is because we serve the state of Washington and we serve students, many of whose parents are frontline workers who have been working through this entire pandemic. So that is why we are going back. And I hear you, and it's like, you may not feel like you were consulted, but I do want to say that Carrie and Uli did run many sessions of a back to school work group within our school that included many faculty and many students. And while they might not have been able to say, we don't want to come back, because that wasn't a choice that we were given, they really weighed in very heavily to the decisions that we made about what kind of special arrangements we would provide, what kind of educational opportunities we would provide, for instance, to our students who have visa problems and can't get here, or who are immunocompromised and can't be in the classroom. So the documents that you see from us in terms of the instructor policies and expectations and the student policies and expectations are heavily informed by both faculty and student input. And I have to say, are much better policies and decisions than certainly I would have made on my own. And we really appreciate those folks who participated in those discussions and weighed in and were consistently lobbying for, not just for themselves, but for everyone in the community.
There's one relatively easy question there, Hillary, about our classrooms that did not have certain equipment in the past being fitted with new technology for recording and microphones. And the answer to that, I'd like to say, is yes. I think some have been. Uli might be in a better position to kind of comment on when that will take place, but I do know there are funds to retrofit and to upgrade many of the rooms.
I don't have any more details on the when. I have the same information as you that's going to happen. It won't, unfortunately, be universal for every single classroom. So we're still having to work to figure out some classrooms.
I think, we obviously brought this to the attention of the campus and HSS months and months ago. The reality is that there's just a large backlog in terms of facilities stuff. So the permanent installation of that equipment is something that will take a while to get in place in those classrooms. But certainly the short-term solution is what Carrie described in terms of us making equipment available to instructors and making sure that, for instance, there's laptops that you can borrow and microphones that we will give you and things like that. Barbara asked a great question about guidelines for faculty for traveling, whether it's personal or work related. And so there, I would refer you to the CDC guidance that links to all of that for both domestic and international travel is provided in that instructor FAQ. We will also update the FAQs to reflect some of the questions that we're getting today to make sure that we're covering those. Yeah, so Barbara, it really depends upon people's vaccine status, where you're traveling, et cetera, whether you're symptomatic. But yeah, definitely check out those links in the instructor FAQ. David asked the question, symptoms for head colds and flu are the same as COVID-19. Please, folks, go and get your flu shots. We're expecting this season may be a bad flu season because we've all been isolated and most of us did not get flu last year. Woohoo! But likely will be an issue this year. And we're already seeing a fair number of RSV cases and other respiratory things circulating. So yes, if you are symptomatic, one, stay home, stay away from other people. And yes, please get tested. We don't want you back on campus, even if you are not carrying COVID, if you are symptomatic. So please be smart about this is not a season where people are comfortable getting other kinds of respiratory pathogens because we're all in sort of heightened anxiety mode because of COVID.
Yeah, I might just add to that, that this is going to be a quarter that's going to be tough. It's going to be a heavy lift for all of us teaching. And yet it also is a transition quarter. We need to continue to be incredibly flexible with how we grade our students, give them credit for the work they're doing, being present in class and not present in class. We have to kind of build in upfront the accommodation, the flexibility that students are going to need because they are doing what we're telling them to do. They're staying home. They're potentially needing to take exams online and not in person. I think the more you think about upfront what we can do to accommodate students in so many different ways, the easier it'll be for everybody.
Yeah, I wanted to come, I'm distracted by the chat thing as we get ready to close out. I wanted to come back to the question about sort of setting expectations and creating this sort of new culture, which is not going to happen overnight. It's not going to be easy. So yes, we are going to work on messaging around that. We are planning to have a back together webinar that will either be during orientation week or the first week of classes. So either first week of classes or the week prior to that, for the whole community, so it'll be faculty, staff, and students, where we'll go through many of those expectations. I understand that's not going to be enough. And so we're working on thinking about other communication strategies, whether it's short videos, social media blitzes. So if you have suggestions of things that you think would be particularly effective, please feel free to reach out and make suggestions. Shiva is fantastic. You can send them to her or to me. Jen Balk has asked, is there an option for additional TA support? So yeah, Jen, so from the provost today, there is potentially, if it is sort of COVID related, additional TA support. So please reach out to Carrie, who can coordinate with me on that. And like in addition, I assume you're speaking about in addition to the to what we have for instructional support. I did see an anonymous attendee said for staff members with objections to getting vaccinated, but who cannot necessarily claim medical or religious exemption, is there an option to have an approved telework accommodation? And my understanding from the governor's mandate is the answer to that is no. So the answer to that is if you are not vaccinated and you do not have an approved medical or religious exemption, you are not eligible for employment at the University of Washington after October 18th. So I'm sure there will be legal challenges to that, but it's not something where legally at this point, the governor is giving us that option. And so we really, at this point, are strongly encouraging those who are able to get vaccinated to please take care of getting vaccinated. Please take care of doing your attestations and let us know if we can do special arrangements for people who need to work remotely because they have vulnerabilities, but you still need to go into the system and do your attestation and still need to get all your documentation in place. So great question. Lots of really good questions here. Jashana asked me, Google that question. Do you want to say you'll be? Yes. So Jashana asked me, do I want to say that I'll be incorporating the responses into my next written update? Yes. So my plan is we got similarly a bunch of questions on the staff webinar yesterday. My hope is to get you guys updated versions, probably of the FAQs that we sent out on the 12th, to update them to include some of the questions that came up yesterday and today. Things continue to evolve and change. So please keep your eyes posted for emails from us, and we will continue to communicate with you as things arise. So thanks everyone who showed up today. Really appreciate it. And I'm looking forward to seeing you guys masked and all in a couple weeks.
Yeah, me too.